Top 10 recent near pandemics deadlier than COVID-19. Times are troublesome as the world groups together to battle the COVID pandemic. However, did you know there were a few close to pandemics in the new past? Truth be told, a portion of the sicknesses in these narrow escapes were far deadlier than COVID-19. Had a portion of these illnesses fallen through the grip of medical services laborers, the outcomes might have been undeniably more calamitous than COVID. Here are 10 later close to pandemics deadlier than the coronavirus. Top 10 deadly pandemics of the past. Number 10, Ebola. Ebola is an amazingly dangerous infection beginning in Western Africa in 1976. The most plausible hypothesis of the illness beginning is blood contact by people with a primate conveying the infection. The underlying manifestations appear to be gentle, including fever, migraine, muscle torment, and chills. Later on, however, indications become dangerous and excruciating, with a casualty encountering inward draining bringing about retching or hacking blood. Ebola is essentially spread through contact with natural liquids of a tainted individual, or an individual who has as of late kicked the bucket from the infection. One strain of the Ebola infection has an almost 3/4 death rate when shrunk by humans. The most dangerous late flare-up of Ebola occurred from 2013 to mid-2016, with 28,646 cases and a stunning 11,323 passings. The pestilence crushed various West African countries, with up to 59% of those hospitalized kicking the bucket. Some different countries outside Africa experienced restricted flare-ups of the infection, remembering 4 patients for the United States who were immediately disengaged. A gigantic piece of finishing the pandemic was thorough techniques for contact following, and isolating. Immunizations were utilized in a restricted part to end the pandemic because of an absence of clinical testing at that point, however have since been utilized to stop a few more modest outbreaks. Number 9, AIDS. Today, considerably more is thought about HIV/AIDS and its transmission. However, in the beginning of the pestilence during the 1980s, there was little information on the illness. The illness was first recognized in Los Angeles, San Francisco, and New York in 1981, yet a few specialists accept that HIV might have been available in people as right on time as the 1960s. Researchers have followed early transmission of the infection to non-human primates. A few misnomers exist in regards to HIV/AIDS, including the now exposed patient zero hypothesis. More than 700,000 individuals have passed on of HIV/AIDS in the U.S. since the start of the emergency in 1981. The infection disproportionately influenced gay and sexually unbiased men, and was known by the moniker gay malignant growth. The infection just spreads through sex or blood contact with a tainted individual. Today, treatment of HIV/AIDS is incredibly improved, with specialists utilizing techniques to keep HIV from advancing to AIDS as a rule. Patients might be endorsed a medication mixed drink of antiviral medications to battle the infection. Number 8, SARS. The SARS, or extreme intense respiratory disorder, plague happened universally in the mid-2000s. The main episode of the infection was distinguished in China, and would spread all through East Asia and to the extent the United States. Roughly 8,000 individuals were tainted with SARS during the epidemic, with very nearly 1,000 passings. Patients with SARS may encounter fevers, throbs, the runs, and pneumonia. The infection is spread through real drops. When a contaminated individual hacks or sniffles, the suspended fluid might be breathed in and taint another. SARS was inauspiciously marked the primary pandemic of the 21st century by the media. In contrast with coronavirus, SARS had a far higher death rate, with 10% of those tainted not enduring their sickness. The World Health Organization and CDC worked eagerly during the pandemic to limit travel and contain the infection however much as could be expected. At last, the United States would see just 8 cases, and measures were compelling in forestalling an enormous flare-up in North America. Number 7, Swine Flu. The 2009 H1N1 infection, otherwise called pig influenza, is a strain of flu which caused a multi-month overall pandemic. This flu infection strain is additionally liable for the Spanish flu and Russian flu pandemics. The sickness namesake comes from the infection emerging from a combination of hereditary material from different bird, pig, and human seasonal infections. This new infection consolidates its hereditary material with the Eurasian pig seasonal infection, bringing about its name. Its side effects are like seasonal influenza, and specialists from the World Health Organization presume that it is no deadlier. Due to the obscure number of asymptomatic cases, it is hard to pinpoint the specific number of cases during the pandemic, yet specialists gauge that it very well may be just about as high as 700 million to 1.4 billion. The quantity of assessed passings range from 150,000 to 575,000 individuals. For correlation, 250,000 to 500,000 individuals pass on from this season's virus every year. Number 6. Cholera. Numerous individuals are ignorant that there is at present a cholera pandemic which has been progressing since 1961 in many immature countries. Cholera basically spreads when people burn through water which is polluted with fecal matter. Consequently, individuals in underdeveloped countries face an expanded danger, and created countries have seen a sharp decrease in cases over the course of the years as sterilization has improved to an unsurpassed high. In the event that cholera is untreated, a contaminated individual can pass on in no time. Regular side effects incorporate loose bowels, regurgitating, thirst, and parchedness, and start somewhere close to 2 hours and 5 days after exposure. The latest flare-up of cholera in the United States finished in 1866, with up to 1/10 individuals living in huge urban areas kicking the bucket from the illness. The essential method to battle cholera is to furnish in-danger locales with satisfactory sterilization administrations and clean drinking water, alongside utilizing cholera immunizations specifically when proper. Number 5. Typhoid fever. Typhoid is a bacterial sickness, and can be conveyed and spread without manifestations. The most widely recognized indications of the sickness are a high fever, and once-in-a-while stomach torment, migraines, and clogging. The infection is known for certain patients creating skin rashes described by rose-shaded spots. These indications are brought about by the bacterium's development in the casualty's blood and intestines. The most celebrated episode of typhoid in the United States happened in 1906, including the scandalous Mary Mallon, also called Typhoid Mary. Mary is thought to have carried typhoid to the United States as the principal asymptomatic transporter. The Irish foreigner contaminated and expected 53 individuals in her work as a cook. She was isolated by specialists yet would get back to her work as a cook, in the long run being placed into constrained confinement for the last 30 years of her life. The scourge's completion was in huge part because of the boundless use of the immunization, which is somewhere in the range of 40 and 90% successful in forestalling transmission of the bacterium, and can last as long as 7 years. Number 4. Whooping cough. Challenging hack is likewise called the multi-day hack, coming from the sickness side effects once in a while continuing for as long as 10 weeks. Challenging hack is a very infectious bacterial illness spread through suspended water drops projected through a tainted individual's wheezing or hack. The primary manifestations of the infection look like the regular cold, however are before long followed by brutal hacking fits and during weeks. After an attack of hacking, a sharp challenge sound might be heard as the individual takes in, thus the name. A few people who experience the ill effects of challenging hack may hack so brutally that they regurgitation or break ribs. Indications regularly start 7-10 days after contamination. Diseases may happen in those immunized, however with more gentle symptoms. Whooping hack influences 16 million individuals every year, fundamentally in agricultural countries, with roughly 61,000 passings. Most cases today happen in non-industrial countries because of the absence of sufficient well-being medicines. Episodes have been essentially lessened in the United States since the far and wide execution of antibodies, yet a few flare-ups have happened in the mid-2010s. One such flare-up in California saw just about 10,000 cases and 10 baby passings after misdiagnosis by specialists. Specialists have inferred that this flare-up and others are in huge part because of individuals from people in general rejecting the antibody for non-clinical reasons. Number 3. Measles. The measles infection is an exceptionally infectious airborne illness spreading through hacks, sniffles, and contact with nasal discharges. Manifestations regularly uncover themselves 10-12 days after openness, and can last 7-10 days. Introductory indications incorporate a high fever, hack, runny nose, and aggravated eyes. A few days after the beginning of these indications, Smallpox spots may create. These are little white spots which structure inside the mouth, seeming like grains of salt close to the molars. After the improvement of Smallpox spots, the measles rash creates in the face and spreads to the remainder of the body. Some different difficulties may likewise emerge from the infection, including pneumonia from measles-prompted immunosuppression. Measles was considered killed from the Americas in 2016, yet cases have kept on being distinguished since. One flare-up in 1991 occurred in Philadelphia, in which 1,400 individuals were contaminated with measles and 9 kids kicked the bucket. This spike started at the Faith Tabernacle Congregation Confidence Recuperating Church, who debilitate individuals to get inoculated. Number 2. Polio. Poliomyelitis is an irresistible infection brought about by the polio virus. Polio is spread by an individual ingesting tainted excrement, and in uncommon cases through contaminated salivation. By far most of those contaminated with polio have no indications, and about a quarter experience gentle influenza-like side effects. In 1-200 cases, the infection moves from the gut to attack the focal sensory system. This makes the individual experience muscle shortcoming, most regularly in the legs. The muscle shortcoming may likewise less usually include the muscles of the head, neck and stomach, and in uncommon cases need the help of an iron lung to keep up typical relaxing. In casualties where some degree of muscle shortcoming happens, 2-5% of youngsters and 15-30% of grown-ups die. The first polio scourge in the United States started in 1894, and huge episodes would keep on springing up all through the main portion of the 20th century. Polio hugely affected America and general well-being, with the most popular case being President Franklin Delano Roosevelt. The pinnacle time of polio in the U.S. happened somewhere in the range of 1916 and 1955 with the endorsement of the Salk antibody. In 1952, there were 57,628 announced cases and 3,145 passings. Polio was dispensed with in the Americas in 1994, and current inoculation endeavors have assisted with killing it from numerous underdeveloped nations too. Number 1. Smallpox. Many believe smallpox to be an infection related with the time of investigation, in the mid-17th century, yet smallpox was not completely destroyed until 1978. The sickness root is obscure, however proof from Egyptian mummies demonstrate it existed at any rate before the 3rd century BCE. Little episodes happened until its annihilation, yet the last significant flare-up in the United States occurred in 1902. The main manifestations of smallpox incorporate fever and spewing, with the inevitable advancement of ulcers and particular rankles. These rankles are described by a mark in the center, and are loaded up with liquid. These rankles ultimately scab and tumble off, leaving scars. A portion of these scabs have been made do in time containers, for example, a scab found in a Civil War time book in the late 20th century. The last smallpox episode started in 1901 and endured 3 years, with 1,596 cases and right around 300 individuals passing on. The pestilence had a 17% casualty rate, undeniably not exactly past episodes in less created countries and without appropriate control measures. The smallpox antibody is the essential justification for the illness destruction.